Welcome to episode 25 of Two Bald Guys, where today we'll be discussing the front line on the war on COVID-19 with some terrific guests who represent frontline health workers across the state of Wisconsin. My name is Dave Anderson, a senior policy fellow at the Wisconsin Institute for Public Policy and Service, otherwise known as WIPPS.
Thanks, Dave. Greetings. I'm Eric Giordano, the Executive Director of WIPPS. And for those not familiar with us, we are a unit of the University of Wisconsin system, founded in 2007 with a mission to educate and engage citizens, develop future leaders, and bring the resources of the university to address community-identified needs. Now, Dave, we're in the holiday season, and there was another miracle for the Two Bald Guys this week. I was talking on the phone with someone kind of randomly who told me, and I quote, "I am a big fan of that show about baldness," unquote. Now, they could have been talking about any number of shows, but I choose to believe that they were talking about ours. So breaking out my calculator here, I believe that brings our fan base up to 4 loyal viewers, which is a 25% increase in the last 2 weeks.
That's amazing, Eric, and it does sound like a holiday miracle indeed. And speaking of holidays, we want to wish our 4 loyal viewers a happy Hanukkah and Merry Christmas. It's truly heartwarming to know that our viewers understand the true purpose of our show, which we think, of course, is celebrating baldness.
Correct.
You know, Eric, with this having been such a difficult and tumultuous year, perhaps we could provide a parting shot to 2020. We've all had to keep a stiff upper lip in the face of the best sprayed plans gone astray. So what do you say, Eric? Can you tilt your head a little and put some shine on this for us?
You know, Dave, I think you've really outdone yourself. I didn't think it was possible to string together so many bad puns in one sentence. So congratulations for that. But yes, actually, I do have a few words of wisdom or a parting joke for you and our 4 viewers. So Dave, some people think that bald guys have no hair, but the reality is that we do, right? And I have to say, I was upset the other day when I saw a little bit of gray on the few hairs that I do have. And I thought to myself, this is it. I'm going to die. Get it? D-Y-E, gonna die.
I got it, Eric, and all I can say is tremendous words of wisdom as usual. If our viewers have any words of wisdom of their own, including a hair-raising pun or joke, they can feel free to share it in the Facebook chat, or they can email us at info@wipps.org. And now it's time to acknowledge and thank our hyper diligent producer, chill hop DJ, and token representative of an attractive younger demographic, Luke Rudolph. Luke, we also understand that congratulations are in order, as you'll be graduating from UW-Stevens Point this month. It makes us happy and proud that Eric and I could contribute to your education by sharing our incredible wisdom with you week in and week out, particularly as we celebrate our 25th week here on Two Bald Guys.
Well, thank you so much, gentlemen. I really appreciate that. And, I couldn't have done it without you. And I don't know if you know, but I actually received a Good Samaritan badge for hanging out with 2 old guys and listening to their really terrible jokes. So I appreciate that.
Yeah. Special congratulations are in order because of that. Hey, and here's something I didn't put into today's script, but I want you to know, and Luke needs to be congratulated on another level. He's done such a terrific job for us here at WIPPS that we're bringing him on we're promoting him basically into a new position as coordinator of our communications and marketing. So Luke, we're so excited not only for your graduation, but to have you as a more fully and higher paid staff member. So we can't call you just a token representative anymore. So congratulations on that. Well, Dave, I think it's time to get to today's special topic, which is updates from the front line of the war on COVID. And we have 2 really outstanding guests, and we want to remind our viewers that if you have questions for our guests during the show, please feel free to ask them by typing in your question in the Facebook chat section.
Thank you, Eric, and it really gives me great pleasure to welcome our 2 guests today. First, I'm pleased to welcome Gina Denick-Champion, the Chief Executive Officer and lobbyist for the Wisconsin Nurses Association. Gina works in close collaboration with the President and Board of Directors of the Wisconsin Nurses Association to plan, develop, direct, administer, and coordinate activities of the association. Gina began her service as the association's executive director in September of 1997. She joined WNA with a background in clinical geriatric nursing and healthcare administration, and holds degrees in nursing and health science administration. So welcome, Gina. We're glad to have you on the show.
Thank you. Nice to be here.
And next, it's my pleasure to welcome Dr. Bud Chumbley, who serves as the Chief Executive Officer of the Wisconsin Medical Society and has been doing that since November of 2017. He was recently named President of the Wisconsin Medical Society Holdings Corporation. In addition to caring for patients as a board-certified obstetrician gynecologist throughout his 36-year medical career, Dr. Chumbley held numerous leadership and management positions, including serving nearly 20 years as president and CEO of a large independent multi-specialty medical group practice, among many other prominent positions in his career. Welcome, Dr. Chumbley. Glad to have you here.
Thank you. Happy to be here. Thanks for asking me.
I'm gonna kick it off and ask you to just expand a little bit on your introductions. Can you both tell us a little bit about the organizations you lead and really who do you represent?
I could start if that's okay, Dr.
That'd be
Chumbley.
great.
So we represent the nurses of Wisconsin, although the Wisconsin Nurses Association is a member association. So you do, become a member. We are also a constituent member of the American Nurses Association. And with that, provide that national support and focus to us here at the States. Our members are nurses from all walks of life. They can be educators. They are nurses working in acute care. They're advanced practice nurses. They are nurses, working in nursing homes. So occupational health, you name this, the setting, and our members are included.
Great.
Well, the Wisconsin Medical Society represents approximately 12,000 physician residents and students, medical students in the state, and we're a member organization as well. We have individual memberships. We also have some group memberships systems that will buy memberships for all of their physicians, and it's our role to improve the physician's ability to provide top quality medical care to their patients in the state. And I think we started a few years before Wisconsin was even a state, so we've been around for about 180 years, and I'm doing my best to make sure that we at least stay around till I retire. And then it'll be somebody else's role. So
I want to share that one of WNA's outstanding history is back before there were trying to pursue licensure for nursing in Wisconsin, so that it had a practice act and it really defined and described what nurses are and what they do. And at the time when WNA was heading to the Capitol and they did their testimony, the one comment of the one legislator was, it's interesting that these women are here considering they don't even have the right to vote. So that's our little saga. I'm not as old as them, but kind of getting there.
Well, thanks for sharing that. And look, you guys obviously represent a lot of people, and a lot of people who are on the front lines, as we've sort of titled the show, dealing with COVID. And it goes without saying that 2020 has just been the most incredibly strange and unique year that I can remember from a healthcare perspective. So we're just wondering if you can step back and give us a bit of an overview of where we have been, where we're going now, where we are now and where we're going in terms of COVID and how it's affected the state of Wisconsin. What are the sort of trends that we've seen and are seeing here in Wisconsin?
Well, I could certainly, probably just like Dr. Chumley, we're always looking at the data to say what's going on in Wisconsin. You know, what are the trends? What's happening with COVID? And, you know, for one thing, we're seeing a decrease in number of healthcare workers who are home sick with COVID or have been exposed to COVID. And that is really supporting the ability to have more beds available for patients in Wisconsin. One of those really direct correlations you'll find is bed capacity is very much tied to the amount of nurses you have available to work. We're also seeing, in general, the number of COVID cases are decreasing, but we joke about leveling off. But if you were to go into a COVID unit, it does not feel like the work has leveled off. I mean, the work is still there, and it's just as intense for everyone that's working on those units beyond just the nursing staff. So I think what we really want to also think about is probably just like you, COVID has affected everyone. Whether you've had COVID or not, it has affected the way we work, the way we live. And I just want to say that for, the nurses on the front line, if we're thinking of those that are actually caring for the COVID patient, we're also looking at the nursing staff caring for those individuals who don't have COVID, but have become very, very ill. They've waited 8 months to get their medical care, their health care. And as a result, they're now getting it into the hospital and requiring just as much extensive care. So we're kind of at that, what COVID has done to healthcare in Wisconsin.
Thanks. Dr. Chumley?
Yes, I mean, it's been quite the year, as we know. And, I think that what highlights that is that I'm not sure we've had another natural disaster or similar episode as this, where the Army has sent units to Wisconsin, to Marshfield, Beaver Dam, and Wausau to help care for the sick. I'm not sure that people realize the extent of how overextended healthcare professionals have become. And at least in my career, I've never seen them set up a field hospital anywhere in the state of Wisconsin. The usage of that was not what it was expected, but it did have, I think it got to a high of 17 patients in the Milwaukee area, but it was there, and it's there again if we see another resurge, after the holidays. And so although we have seen some tapering off of cases, I think that we're not quite out of the woods yet. We'll need that vaccine, and we'll need to continue to social distance, wear masks, wash our hands, at least for another few months. I do have some slides I can share that shows this graphically, if you'd like me to. That's up, whatever you
Sure.
play.
Yeah, I think it could be helpful to see some of that.
Okay. All right, I got to share my screen.
While you're waiting, I would just ask Gina Denick Champion really quickly. We were hearing in the news that California may surpass its capacity in terms of beds, and I know that was something you raised. Are we anywhere near that in Wisconsin? Is there any threat of not having the capacity to handle these COVID cases from what you've seen?
So I looked at the data today, and on average in Wisconsin, if we just look at as an aggregate, we have only 16% of beds available in Wisconsin throughout our hospitals. When we look at the Fox Valley area, there's only 8% of beds available. And I want to say it was the western part of the state. That region has 24% beds available. And again, if we think about it, it's not just COVID beds. It's all beds. So if I'm an individual who needs healthcare, and it's not even the elective surgeries anymore, it's a person that needs hospitalization. That's the scary part. Is it may not be filled with all COVID patients, but it's filled with other patients needing some very extensive healthcare and nursing care, and that continues to fluctuate. And I think we're going to continue to see that sort of that ebb and flow or the yo-yo effect unless we can really figure out how we can convince all of Wisconsinites to wear a mask. You're going to hear that
Great.
coming from me a lot, but.
Okay, good. Thank you. Dr. Chumley, what are we seeing here?
Well, first of all, this was put together for a presentation of the Metropolitan Milwaukee Association of Commerce by John Raymond, who's the president and CEO of the Medical College of Wisconsin. He's been doing this for over a year. First it was every week, and then I think it's every other week, and now I think it might be monthly. And I apologize for the noise you hear when I get an email, but I'm not savvy enough to figure out how to turn that off. So I'm surprised I can screen share. But anyhow, I think the most important thing on this slide is that it gives you a world view, a US view, and a Wisconsin view. But I will draw your attention that the death rate in Wisconsin overall is 0.9%, which is half of what it is nationally. And I think that's a testament to the doctors and nurses and the quality of healthcare in Wisconsin. We've always been in the top 5. Many times we fight it out with Minnesota to be number 1 and number 2 of certain parameters from the Department of Health nationally. So we really have done a really good job of that. Again, we're beginning to, I'm sorry.
Dr. Chumley, can we go back for just 1 second? I want to ask you about the third row. If you can scroll back up a minute.
Yeah.
What does it mean that, the recovery rate, is that why the difference between the national recovery rate and the Wisconsin?
I think it's probably a reporting issue. In Wisconsin, you're considered recovered. If I get this right, I think is if you are asymptomatic after 30 days or have a negative COVID test after 30 days. But unfortunately, and I'm kind of glad you asked that question, because unfortunately, that doesn't really mean that you're recovered. We have those long haulers, people that have mental confusion, people that have neuromuscular symptoms, loss of taste, loss of smell. I mean, when you say recovered, it doesn't really mean that everybody's back to normal. It takes a long, long time to get back to normal. So I think the difference is how we report it.
Oh, thank you. Thanks for sharing that. Were you going to scroll down to something?
Yes. Yeah, I'm just a little slower here.
No problem.
Okay. So the cases are declining. You'll see that from this, we dropped from four weeks ago. We've declined from this, but still exceeds the spring surge which we have, and we'll talk about the reproductive number. The death rates have dropped a little bit, but it's still averaging at 47. I think that's an important number as well. But again, deaths will lag by about 5 weeks. This is, I think, an interesting slide because it shows you that, in early November, almost all counties in Wisconsin had a critically high rate of COVID per 100,000, and it's decreasing where many are into the high to very high, but it's still high to very high across the state. We really aren't out of the critical area, but the burden has decreased in many counties, which is good. COVID hospitalizations have dropped. The ICU census has declined. But the thing to understand there is that we may have ICU beds, but ICUs usually have an optimal occupancy of about 85%. When they get about 85%, their efficiency goes down. It's harder to give people all the same quality of care. And so when we're above 75, 80%, I think that there's a lot of stress on the symptoms or on the staff, I'm sorry, excuse me. This tells you, which I think is interesting, the number of people that are tested positive, new cases since the 30th in Milwaukee and statewide. I may skip a couple of slides here. Oh no, that's not what I wanted to skip here, but sorry. But this shows you kind of where we're at in Wisconsin and Milwaukee County. But let's look on the left-hand side of the slide. We'll see that the cases by date, did peak in late November and are coming down, which I think is good. They did the same thing in Milwaukee. So that's what Gina was talking about, is that we are having some improvement. The death rate is coming down too. We had a little bit, so hopefully, but again, the death rate lags by 5 weeks. You know, we have not seen a spike after Thanksgiving. My hope is that we will not see a surge or a spike after the Christmas holidays, but this graph gives you that representation. And the R rate is something that's the number of people that are infected by an individual. So if early in the epidemic, it was like 8. So an individual who had COVID would infect 8 other people. So right now we're below 1, which is very, very good. That means an infected individual will infect less than 1 additional person. That's why things are slowing. But to really have this become extinguished, that R number has to get below 0.5 or so. So we have a ways to go. And I think the only way we're going to get there is via a vaccination. And so
that's sort of, Dr. Chum, that kind of addressed a question that I had, but I wanted to have you elaborate briefly. So is that lower R rate or number, is that have to do with changes in behavior primarily, like the fact that we are masking more and social distancing more, or do you think it has more to do with the disease itself and something about how its nature and how it's being spread or not, or do we just not know?
Well, let me scroll down and let's see. There it is. These are not smarter people than me came up with these 3 potential theories. One is just what you said, that people are being more diligent about protecting themselves. There's a low-hanging fruit hypothesis that most susceptible individuals have already gotten infected, and thus those are the people who had a different behavior or were in higher risk groups. So we're down to people that are taking better care. And then the interesting one I found was the network hypothesis, is that the key people at the nexus of social networks have already been infected. And I think we all know people who are very, very social, that see a lot of people all the time. And, my stepdaughter is one of those people. I mean, she has a great deal of friends and they're always getting together and they always are going to high school games and this and that. She hasn't been infected, but we've kind of you could call them super spreaders. All the super spreaders or the super social people have been infected and thus they aren't infecting anybody anymore. I thought that was a particularly interesting theory. But we're not close to the 70% for herd immunity,
Right.
and we won't get there until the vaccine comes online, I think, significantly.
I also have to think about, as with the governor trying to restrict hours of, bars and restaurants and other places where you could have groups of people, say the training gym, so to speak. So I do think that has also contributed to it's certainly not helping the economy, I know, but I think it also is supporting some of the goals that we want to achieve in terms of lowering the risk.
I absolutely agree. That's a good point. And then this is the rest of the slides are about vaccine. If you want to talk about vaccines later, we can as well.
Yeah, we'll get to that a little bit later.
Yeah.
So thank you for sharing that. Dave, did you have a question?
Yeah, although I do want to ask a vaccine related question that came to us from one of our viewers. So then maybe we can just take that one up right now so we can make sure that our viewer questions get answered. But our viewer would like to know, will this need to be a yearly vaccination or will the virus eventually die out? So what's the wisdom on that?
Well, again, this is not my wisdom. This is a group of epidemiologists that I keep up with, but most people feel that it may linger. It may have to have an annual flu vaccine type of thing, just like we do the flu vaccine. But we won't know for sure until we get herd immunity and then we see what happens.
Okay,
Does that
great.
answer your
Thank
question?
you very much. Yep.
Yep.
I think that does. the national media has paid a lot of attention to the stress that this has put on frontline workers across the country. You alluded to it just a few moments ago too, Dr. Chumley. But we're kind of curious to know, what are you hearing from your members who are really on the front lines here in Wisconsin, dealing with COVID-19? What's it like for them dealing with this pandemic day in and day out for as long as we've been dealing with this here in our state and across the country? So what are your members telling you?
Jeannie, you want to go first?
Sure. And we're hearing stories, but so there's the nurses that are delivering the care in the COVID unit, and I mean, there's rotation, but there's a pretty, I would say, consistently assigned workforce. And I think I worry about those folks the most because, they are there caring for their patient. And, we always talk about patients when they enter, the hospital or even a nursing home, that these people you are at your most vulnerable state, I would say. Think about our vulnerabilities and because first of all, medical knowledge is hard to understand if I'm the consumer and try and get that translated. But when you think about that, the person in that bed who's on the ventilator, wondering day in and day out, am I going to die? And being able to have someone to talk to you about your fears and your concerns. Someone available to help bring you the iPad or the phone, so you can talk to your loved ones. And it's, the nurse bringing the iPad or the phone to the patient when it's time to say goodbye to their family members because they're not going to live. And they're holding the hand of that, particular patient. And also, I think what helps us thrive are those patients that get better. Those are the okay. This disease can be conquered, so to speak, in that particular setting. So I worry about those folks because of the day in and day out. But at the same time, I have members that are school nurses, and you think about the stress of one day the kids are in school, one day they're not. They have those kids that are at home who really don't have any resources, and they've been pretty intense in taking care of them when they're in the school. Now they're also having to follow these kids at home to make sure that they're safe. These school nurses are also the ones that are kind of doing the testing and needing to do the reporting, and try and get their other, trying to get the PPE and all those things. So you have the school nurse. You also have, the nurses in the clinics, our advanced practice providers. They're at risk of feeling exposed. Everybody, nurses feeling exposed and not, that I'm going to get COVID. So I think it's a consistent worry. Nurses report feeling overwhelmed, very, very anxious, because they're, it's not at the time, but I have to hold this all in until I get home, right? And then I can let it all out. But if you can't let it all out, you're trying to compartmentalize everything. Eventually, it is going to catch up with you. So really trying to help nurses, or if there's helping nurses try and figure out how they become resilient again. But it's been tough on everybody. We know that, going home and having to isolate, going home and I don't want to give this to my children. And just the day in and day out. I think nurses are also very feel supported at work in most cases. That team that's working together, with the physician and the respiratory therapist and chaplains are all, management, all trying to do the best that they can.
Thanks.
I would certainly agree. I think nurses are a particularly empathetic group of people, which I've always been kind of proud that 2 of my 4 children became nurses. I'm not sure. I'm glad they're nurses and not physicians, because I think they've dedicated more time to their families than if they followed their dad. Then that wouldn't have been great on family life. It wasn't great on my family life when I was practicing. But the physicians are burned out. At statistics are 35-40%. Resiliency is down. it's a real problem, but they go into work every day as the nurses do, and they get it done. And hopefully for this, if cases continue to decline and don't surge again, we'll make it through as we continue to it'd be nice when everybody got vaccinated, but we're woefully short on that. We've had 450 healthcare workers in the state that needs vaccine, and I think we might get 50,000 done by the end of the month, and then after that, you hear different things on different days.
Mm-hmm. Mm-hmm.
Great. I really appreciate you sharing that, and I think that's I hope it's a concern for all of us here in the state, because if we're going to get through this, we've got to make sure our frontline workers are safe and feeling well. And speaking of that, and you may have already kind of addressed this, so it's okay if you don't have anything to add, but do we have any information about how nurses and doctors are doing, other allied health professions are doing in terms of their physical and mental well-being? Are we doing okay? I mean, maybe we don't even know what the long-term ramifications are, obviously, of all this stress that's being placed on them. Or do you feel like you have a handle on how things are going?
I'll let Dr. Tremblay go first. And probably been doing
Well, I think the only handle we have is some of the survey data that shows that 30 to 40% of physicians are quite burned out and stressed, and and actual social signs of depression, and I don't feel the medical society has done enough. I don't think individual systems have done enough. It kind of varies from system to system. But part of the problem is that all systems have employee assistance plans, EPA plans, but I don't know very many doctors or nurses that want to call their system-sponsored EPA provider and say, "Look, I'm really burned out. I'm having trouble." So I don't think they utilize those services, and we don't have a very good system to provide help. We're working on some ideas on the county level to provide them free access to psychologists. And hopefully we'll get that up soon.
That's one of the things that the American Nurses Association has done, is they've really taken on the healthy nurse concept and, helping with resiliency and have incredible amount of resources, including free, being able to, the apps where you can talk and chat. And what we are in the process, we are very excited. We have 3 DNP students, Doctor of Nursing Practice students from Milwaukee. They're actually working on a tool kit for us based on the nurses' feedback about what they need to recover from this and building their resiliency. So the toolkit will address specifically the issues that these nurses are sharing that they're experiencing. And the goal is to actually create an app. I mean, I don't know anything about that, but they're the millennials. They can make it happen. And I can learn something new, but it's just tough out there. It is tough. And I want to say that probably Dr. Tremblay would agree that even prior to COVID, things were getting a little tough in the, in the settings. I mean, so many changes, so much technology, so much, and trying to do more what feels like with less. And, there was a nursing shortage before. We're going to see even a bigger one in the future if we don't do some other sorts of solutions. But
I think that's an excellent point. The shortage. I mean, we're doing okay now, but the projections are for significant shortages in the next 5 to 10 years of nurses, physicians, and healthcare workers.
I think with COVID, it certainly, again, we saw when nurses were out sick or quarantined. Some were home because kids were home. Someone's got to teach them, right? So we kind of lost a big group for a while. And with that, again, it had the impact on who can get admitted and who can't be admitted. But that was sort of the snapshot of, if we don't do something soon about the nursing workforce, we're not going to have enough nurses, because the demand and what we've learned through COVID, the different things, so nurses are being deployed to do different things, that we're going to need more. The biggest thing that to part of that is we don't have enough nurse faculty. And I won't talk a lot about that, but we don't have enough faculty. So how can you graduate 300,000 nurses that you need every year if we don't have enough of the faculty? So our one solution is we are trying to get something put in the budget to help recruit nurses to want to become nurse educators. We're hoping that'll help.
So both of you have kind of touched on this already, and it kind of leads into my next question. But has the work of your association or the role of your association changed as a result of COVID-19 and the pandemic? Like I said, you've already talked about some aspects of that already. But are there some other ways that your association has been affected by the pandemic as a whole?
You know, I think we went into COVID mode. And by that, we had 3 councils, and we have our board of directors where we developed a strategy for how we're going to support nurses, you know, in responding to this COVID. And I swear that's all I focused on for like 3 months, you know, living and breathing, you know, supporting nurses during COVID. And the days and the hours that you put in, you know, not like, and being at home, so the clock isn't ticking or anything. You just kind of hang downstairs where I am and get it done and head upstairs. My husband's retired, and I kind of ask, well, how was your day, dear? You know, even though we're just a floor apart, but it's about policy. It's about advocacy in the workplace. It was about getting nurses the education and the latest information about what was happening, conducting surveys and what does that mean, trying to just whatever we could without overwhelming nurses about this is what's happening, this is what we hear, this is, and what are you hearing? So that every week we met as a group and just kept trying to do what we could to. We also partnered or collaborated with 20 other nursing organizations to identify what's an issue we can all work on together. And that was the topic of resiliency came up. So that's kind of been everybody's effort and major project as nurses.
You know, I echo back, once this started, we just went into COVID mode, and I have thought about very little besides COVID, how to get information to the physicians, out to the physicians, sponsoring webinars, sponsoring CME events, trying to get a list of, a chart of activities which are at risk to the individuals in the state. And so other things like the burden of electronic medical record and paperwork and funding and universal coverage. Those things just kind of fell off the plate as we've headed through this year. I'm sure we'll get back to them once you can get the vaccine distributed mid-year. But right now, I don't see that changing for a few months.
I was thinking the only day I did not think about COVID first was election day. But every other time is COVID, right? And yeah. I mean, we live in, and I do have to say, I think the Medical Society, you've done a really good job.
Well, thank you.
Trying to support the physicians that, because it's not easy for those guys, women and men either.
Yeah, we appreciate both of you sharing that and what you're doing as organizations. Dave, I think we're ready to turn back to vaccines, and I noticed we have another viewer question. Did you see that? Or
I did.
Okay, go ahead.
So, it says several states say they have been told by the CDC to expect far fewer doses of the Pfizer COVID-19 vaccine in the second week of distribution. Washington State was told 40% less than this week. What's the status of distribution for Wisconsin? And will it also be reduced by a significant level next week? Any insight or any background on that that's come your way?
I bet you Dr. Chumley knows.
Well, I do have the DHS's Southern Regional Office. They have these emergency and I forget the name of the overarching committee. Maybe Gina, maybe you recall what it is. But
Mhm.
it's called SDMAC. SDMAC. But they met this morning. What is that? SMAC?
SDMAC, that's the,
Yeah.
I'm on their committee. Yep.
Okay. Were you on the meeting this morning?
No, that's the
No,
different group.
this is a different group. But okay. So I can give you the update. Boy, there'll be more information than you wanted, but
Yeah.
24 hospitals and clinics have received the vaccine. They hope that Moderna will arrive over the next 2 weeks. They don't know exactly how many. Again, that's where the number of 450,000 healthcare workers. The feds will update DHS every Friday. They have updated them that they're not probably going to get as many next week as they had thought. The national news seems to, people are pointing fingers at Pfizer, and Pfizer's pointing fingers back at the feds. So who knows exactly what's going on. They have decided, though, that that they will probably get less next week. Another important decision they made is that they will use all their doses to initially vaccine people. There was always this question: if you have 50 million doses, do you give 25, save 25 for 3 or 4 weeks from now? Well, they're betting on that the supply lines will hold, that Pfizer will be able to deliver more vaccine before that 3 or 4 week period. And so they're going to go ahead and use all the vaccines they get to immunize frontline workers. They have started vaccinating people. They've run into some transport problems. It was interesting that when a couple of questions that came up, I mean, the vaccine there are hubs. I think there's 8 hubs. They don't announce where they are. They don't want anybody to know where they are. They deliver vaccines, with the National Guard and the Highway Patrol. So if you see a truck going down the highway flanked by Army trucks and Highway Patrol, it's probably a vaccine, which is kind of interesting.
Yeah.
So it changes from day to day. I mean, I think they're doing absolutely the best they can. They're rolling it out. It takes very low temperature freezers to keep this stuff, and then it has to be given within 6 hours once you take it out of there. And so things will get easier when Moderna's vaccine comes out, because it only has to be in a normal freezer, refrigerator.
Yeah.
And then some of the next vaccines are much more stable. So.
Yeah, I'm kind of, so with Moderna, I think they're applying for EUA right now, emergency use authorization. And I think, is that just a one shot?
No, that's a 2-shot.
It's also a 2-shot. I'm going to wait for the 1. No.
I mean, there was hope that Johnson & Johnson would come out with a 1-shot, but I was just informed the other day that they have started to forgive the pun, but a 2-shot arm.
Okay.
Because they weren't only getting 60% effectiveness with the 1-shot. So we may not end up with any vaccines that just require 1 shot, which is too bad, but it looks like it might be going that way.
Yeah, I think that's another variable, is that people are going to need to come back, and hopefully the compliance rate, I think the folks right now that are getting, vaccinated, but folks down the line, if, they end up with a really bad sore arm or a side effect, that I'm not going back, but the importance of, really making sure you're getting both of the vaccines.
Because they're only projected to be about 50% effective after the first dose, but after the second dose, about 5 days after that, you're 95% effective. So it's pretty critical that people go back.
Yeah.
Just one more vaccination-related quick question. Of course, we know that the national regulatory agencies have given guidance on what the priority should be for vaccination. It's kind of up to the states to determine what that priority is in their various jurisdictions. Maybe for the benefit of our viewers, kind of what's the plan for Wisconsin? Just remind our listeners and viewers what the vaccination priority plan is for the state of Wisconsin.
Well, I think just like all the other states, the healthcare workers first. They are now also, I believe here in Wisconsin, they're starting with the nursing home patients, or soon to.
Well, as of this morning, they think it might be 2 weeks because the numbers of 1As, the doctors and the nurses working in the emergency rooms and the ICUs and the respiratory therapists, that's going to take
A big group.
a
Yeah.
big group. So I think they just told the nursing homes about 2 weeks.
Okay. Okay. So that'll be next. And then the other pieces is then who, who should be next. And they talk about those individuals with those chronic conditions that can be really susceptible to getting COVID would be next. Then I think they're saying like, so it's the elderly and but start even with the not so healthy elderly. And then eventually getting down to, and I think they're not even talking about children, I don't think, or.
It currently goes down to age 16. There are some studies that are going on, in children, but they aren't talking. I think I do have a slide if you want me to go to it that describes that distribution, because I can't ever remember it, if you'd like me to.
Sure,
Okay.
yeah, let's take a look.
Okay.
Not talking about it in your sleep?
While the slide is coming up, I do have another question too, and maybe I've just missed it, or maybe I'm just ignorant of it myself. But for people that have had COVID, where do they fall in that vaccination priority? And do they even need to get a vaccination if they've had COVID already?
It's my understanding that they are recommending, because they don't know whether you can, but I'm not sure. Maybe it's probably in the graphic that Dr.
This, I'm sorry, that was a different slide deck, but I
okay.
think Gina really did. I mean, it's the healthcare workers, then it's the nursing home, and then it's those elderlies that have comorbidities, and in somewhere it's the essential workers either come before or after those with high risk over age 65. I think they're still debating that, the essential workers, and then you throw in the mix of the populations that have a higher morbidity, like the brown and black populations, whether they should be set ahead, and that the really healthy people are probably not going to see it until late spring or early summer. Some people think maybe sooner, but that's probably the way it's going to be.
I think the health disparities in Wisconsin, in particularly the our brown and black populations, we didn't see that until COVID hit. You hear about it when there are hurricanes in other parts of the states that get hurricanes, and you begin that always pops up, that the people with the health disparities, the working, the poor, and all of that. And I think about the fires and those kinds of things. But in Wisconsin, we're really, pretty insulated from all of that. So it was, I think, a real eye opener for all of Wisconsin to see. It's really important that these people need, as these folks get hospitalization and the outcomes, if not dying, then you've got all the other sorts of health issues that follow getting out of the hospital with COVID. And it's a lot of resources, a lot of healthcare resources, and kind of turned up the dial. I hope that we begin to really start paying attention to prevention and health promotion among that population.
Before we leave the topic of vaccines, if you indulge me a minute, I think it's very important that I say that they're safe. These vaccines are safe.
Mm-hmm.
They've done studies in 30, 40,000 people. We have had some anaphylactic reactions to Pfizer in 2 people in England and 2 people in Alaska. And but there's no truth to the fact that the effects are genome, or they get in our DNA, or they cause other problems, Alzheimer's. I mean, you hear all sorts of stuff. You can go anywhere and find somebody suggesting that they're going to cause all. That doesn't mean they're not going to be without problems. When we gave the swine flu back when I was in medical school. A number of people developed a neurological condition called Guillain-Barré, where they got numbness and actually were paralyzed for a period of time, but most of them ultimately cleared. I mean, we may see something and we may not see it for 3 or 4 or 5 months or a year, but there is a good reporting system in place for adverse reactions. They're tracking it. They're trying hard to figure out why these people had allergic reactions, although they did have allergic reactions to other things in their history. So they recommended if you carry an EpiPen or you've had allergic reactions or allergic problems, that you get the vaccine in a controlled environment. Thank you.
Well, and I think the other thing is this is such a different vaccine than all the others. It's not a live virus. It's not even structured that way. It's a very different way that this has been prepared, and I think that's important to remember as well. Even with our influenza every year, it's not coming from that sort of place is how it's being, what it is that you're receiving.
Great. Well, this has been a tremendous discussion, very enlightening, educational. Thank you especially for those last comments to remind us that, if we're going to beat this thing, then we're going to have to be vaccinated and hopefully develop that herd immunity that you discussed earlier. So thank you both so much. Gina Denick Champion, Dr. Bud Chumbly, thank you so much for being a guest on our show today. We really appreciate your time and we wish you the very best. We also want to express our heartfelt appreciation for all of the frontline medical workers who have been tirelessly working on behalf of our population to care for our citizens and residents during this obviously very challenging pandemic. So thank you. And once again, we want to apologize to Dwayne "The Rock" Johnson for running out of time, but we'll be sure to have him on again in our next show. And speaking of our next show, Dave, when is our next show?
Gosh, I think, Eric, it's going to be after the first of the year. So probably whatever that first Friday is after the first. So we look forward to that.
Yep.
And I just want to say to our guests, thank you very much for spending some time with us today. I've had the pleasure earlier in my career of working quite a bit in state government, and both of your associations have been a tremendous resource for policymakers and those who work with the legislative process and policymaking process. And kudos to you for representing your members as well as you do. And with that, Eric, I'd just like to say thanks and happy holidays to all of our viewers out there.
Happy holidays. See you next year.
Thanks for inviting us. Thank you.
Thank you. Don't forget your mask.
Absolutely.
Okay.